Communication and interprofessional collaboration. I will talk in this podcast about the 3 points: role of different type of communication, role of communication managing conflict and solution, role of interprofessional working. The first one will be role of different type of communication. To offer the patient high quality treatment and easy tension, the patient and nurse must have adequate professional communication, identifying useful aspects of the building of appropriate professional communication could prove crucial in averting these challenges. To respond to inquiries, learn about a person issues and requirements, and take part in team meetings. Assistants need a variety of verbal communication abilities. Inform others of terrible news and help those who are experiencing difficulties. Always strive to talk with clarity, accuracy, and sincerity. Additionally, it's critical to understand your target audience and tailor your communication to their age, culture, and level of health literacy. Speak more slowly to give the other person time to comprehend what you are saying and respond. Speak abruptly of raising your voice can frighten people, so refrain from doing so. Don't act or speak like a child or as if the individual isn't present. Always be considerate and patient and include them in your communication. Inside the whole different type of communication, I will talk about effective communication. The ordinary courtesy that people perform as a formality is not referred to as communication. Gaining a better understanding of someone can be facilitated by casual chat, but it is not the same as successful nurse-patient interaction. Multiple, multiply ways that nurse can communicate with patient and their relative more effectively. Nurse can use several efficient responses to help patients understand a word or get more information from there. Even though the same response may not be appropriate for all patients. As patient communication can frequently be imprecise, this is very crucial. Not the point is the writing communication. Although it is encouraged, writing communication between healthcare providers is still the most popular method in practice. Face-to-face communication gives all parties involved the ability to not only hear what is being said, but also to observe the body language and facial expression of the other person, which is crucial information that helps them better grasp the words that are being said. For example, it can be delivered quickly and simultaneously to the required number of carers involved in the care process, used for future reference and used for other purposes. Indeed, a lack of effective communication can have a variety of detrimental effects, including care discontinuation, patient safety risk, inefficient resource usage, patient unhappiness, overworked doctors, and hidden finance repercussion. Since written contact between specialists and primary care is still the most common type. Another point is the nonverbal body language. It's crucial to employ acceptable body language in a career like nursing, which involves frequent communication with patients, other nurse, doctor, and other staff members. A smile will communicate to others that you are content or optimistic, and an expression of grief or disapproval is a frown. A wrinkled brow may indicate dissatisfaction, rage, of perplexity. It is crucial to ensure that your facial expressions are adequately in line with the message being expressed verbally. Make careful to maintain clear eye contact and pay attention to your facial expression when conversing with client or colleague. Again, make sure that your facial expression match the message you are orally delivering and doesn't reflect an emotion related to a private matter. For example, if you are anxious about commit and other issue outside work, attempt to hide that anxiety for the patient you are caring for. Patient can't read mind, so they can think that you are worried, especially has something to do with them or their condition, which could cause them unnecessary stress. Role of managing or a conflict and negotiation. It's no surprise that conflict will arise in nursing and other healthcare specialization when you are considered the pressure that come with providing care for life. Most nurse dispute situations shouldn't turn hostile. There's always ways to diffuse tense situation and work on your conflict resolution skill as a nurse, even if you don't agree with the patient care plan, don't like how someone is managed a problem, or even serious disagree with the morality of some operation. Ego-based conflict happen when arguments about how to handle a specific issue are complicated or aggravated by the danger of harm to one or more parties' self-esteem and perceived status in the relationship. For example, a nurse asks a doctor to check a pharmaceutical prescription before giving it to the target patient. The doctor views the query as a sign of mistrust in his knowledge and publicly lambasted the nurse and complained to the on-call nurse about the travel nurse. Instead, he reacts publicly. The nurse seeks the charge nurse assistant and encourage in locating a chance to speak quietly with the doctor about the situation and her troubling emotion. The conflict between a nurse and a team can be stopped or de-escalated in several ways, including by compromise and working together. Conf- While the result may not be equally shared as a compromise approach, nurses will decide to work together as their conflict resolution strategy incorporate ideas from others into their own. The improved group buy in a general approval with the final decision. Role of interprofessional working. Clients who would profit from interdisciplinary nursing are identified by the nurse. Interdisciplinary care conferences are gathering when medicine team members collaborate professionally, share knowledge, and develop joint intervention to address client requirements. Nurses have a crucial role in addressing patient needs during interdisciplinary care conference as members of the interprofessional team will probably spend most of their time at the patient bedside. To convey and advocate for the client requirement, the nurse employ effective communication strategy. She also pay close attention to suggestions made by other members, develop a shared plan of care, and record it in the client plan of care. When the patient is enabled to defend himself, the nurse guarantees his safety while also defending high right of interest. For instance, the interprofessional team must frequently provide forceful support to clients who are unconscious, mentally challenging, illiterate, or confused to effectively meet their need or preference. To preserve the continuity of care, guarantee that each client transition to care is seamless and without disruption. Nurse play a crucial role. The definition of continuity of care is to use of information about past events and personal sequence to design current care appropriate for each person. Admission into a facility, moving from one unit to another with the same institution, moving from a facility to another being discharged, or to the patient home, a long-term care facility for all examples of transition in care. Tough appropriate handover reported the documentary nurse support smooth transition collaborate successful with interprofessional team.